Hello everyone. I am myself Dr. Rajesh Gubba. I'm the general medicine educator. This is a recall session and this is a session of the Rajasthan MO exam general medicine recall questions. So we have totally 6 questions in this particular session. Let me discuss one by one. So the first question is, which of these is not a type of the generalized seizure? Atonia, absent seizure, myogenic, and tonic-clonic seizures. So, if you take this particular epilepsy or seizures, we classify them into the two types of seizures, that is the true seizures, that is focal seizures, and as well as the generalized seizures, right? And this generalized seizures, again, we have the following type. One is GTCS, generalized tonic-clonic seizures. Second one is the absent seizures. And third one is the atonic seizures. Fourth one is myoclonic jerks. Right? Fourth one is the myoclonic jerks. And yeah, so these are the examples of the generalized seizures. And the one among the example which has the question which has been given to you, which of the following is not the generalized seizure? That is myogenic. We don't have a type of a seizure called myogenic seizures. What do we have is myoclonic jerks are there, and these myoclonic jerks, they are the form of the generalized seizures. And these focal seizures, again, like previously, these were termed as the partial seizures. And these partial seizures, depending upon the consciousness present or absent, we classify them as the simple partial seizures, where the consciousness of the individual is being preserved. Then, second one is the complex partial seizures, where the consciousness of individual is being lost. That is what is called as the complex partial seizures. And in case of the GTCS, the drug of choice is the valproic acid. In absent seizures in age less than 4 years, the drug of choice is ethosuximide, and age more than 4 years, the drug of choice is valproic acid. Atonic seizures also, drug of choice is valproic acid. Myoclonic jerks also, the drug of choice is valproic acid. Whereas for the focal seizures, the drug of choice is, or the first line drug is the carbamazepine. Then you have many other first line drugs like levetiracetam, right? These are the other drugs which can also be given, but among all those, the first line is the carbamazepine, right? So among the options which has given to you, like which of the following is not the generalized seizure, that is myogenic seizures are not generalized seizures. Okay, now following that, you see the next question. The ratio of pulmonary ventilation to pulmonary blood flow for whole blood at rest is 1.3, 4.2, 5.5, 0.8. Now, what is this pulmonary ventilation to pulmonary blood flow? This is nothing but ventilation perfusion ratio. Right? This is nothing but ventilation perfusion ratio. Now, you take the pulmonary ventilation. What exactly you mean? This is the amount of air that reaches the alveoli per minute. That is what you mean by this word pulmonary ventilation. This is the amount of air that reaches the alveoli per minute. And at rest, the average adult has the pulmonary ventilation rate of 4 liters per minute. Right? Pulmonary ventilation rate of 4 liters per minute. Then you take pulmonary blood flow. Pulmonary blood flow is represented by Q, okay, which is nothing but VQ ratio. Now, what is this pulmonary blood flow? This is the amount of blood that flows through the pulmonary capillaries per minute. That is what is called as the pulmonary blood flow. And at rest, the average pulmonary blood flow, it is approximately 5 liters per minute. So if you take the ratio, this is around 0.8. So the normal ventilation perfusion ratio, that is nothing but VQ ratio, is around 0.8 is the correct answer here, right? Coming on to the next question. Most common symptom of the retrosternal goiter: dyspnea, dysphagia, SVC syndrome, and then cough. Now, you take in case of retrosternal goiter, you can have all these clinical features in retrosternal goiter, but which among this is most common? See, the most common is the dyspnea. Now let me explain you why the dyspnea is more common in case of the retrosternal goiter. Now if you take the thyroid, like exactly behind the thyroid, what you have is, you have the presence of the trachea, right? You have the presence of trachea, and behind the trachea, like you have the esophagus, right? Now in case of the retrosternal goiter, right, when the individual is inhaling, the goiter, it moves lower down and it exactly comes behind the sternum and it compresses the trachea. So once it compresses the trachea, the most common symptom will be in the form of the dyspnea. The most common symptom is what? Dyspnea. Now, after this particular dyspnea, when the compression is still more severe over the esophagus, there can be development of dysphagia, right? And if this goiter also compresses the mediastinal structure like superior vena cava, there can be development of superior vena cava syndrome. And there can also be cough because of the irritation to the trachea. But the most common symptom will be the dyspnea, right? And in case of these large goiters, there can also be hoarseness of voice, right? There can also be hoarseness of voice. And this particular hoarseness of voice, it is due to compression over the recurrent laryngeal nerve, right? So the most common symptom of the retrosternal goiter is the development of the dyspnea, right? Next question. Nephrotic syndrome is characterized by all of the following except proteinuria, hyperlipidemia, edema, and hypertension. Now, what is the manifestation of the nephrotic syndrome is the proteinuria, right? So, if you take the 24-hour proteinuria, right, 24-hour proteinuria, it is more than 3.5 grams per 24 hours. That is what is the 24-hour protein that gets excreted in patients with the nephrotic syndrome. And within this protein, the protein which is being excreted out is the albumin, right? The protein predominantly which is being excreted out is the albumin. Now, once the albumin is being excreted out, the oncotic pressure is reduced. The oncotic pressure is reduced. Once the oncotic pressure is reduced, the fluid from the intravascular compartment will enter into the extravascular compartment, resulting in the development of the edema. So there will be like proteinuria and there will be also edema, right? Then followed by that, now in order to synthesize the albumin, the synthetic capacity of the liver, it increases. Once the synthetic capacity of the liver increases, there is also increase in the synthesis of lipoproteins like LDL, VLDL, and so on. So once there is increase in the synthesis of the lipoproteins, that will result in the development of the hyperlipidemia. So proteinuria, hyperlipidemia, edema, these are the features of the nephrotic syndrome. And the other features of the nephrotic syndrome, because it is predominantly the albumin which is being lost, so there will also be hypoalbuminemia, right? There will also be hypoalbuminemia, right? Then followed by that, the next important feature that you need to know is the hypercoagulability will be there. So there is increase in the coagulation factors, right? And followed by that, hypertension is not the feature of the nephrotic syndrome, because in nephrotic syndrome, like what are all the various causes for nephrotic syndrome? That includes diabetes mellitus, that includes minimal change disease, that includes the focal segmental glomerulosclerosis, that includes membranous glomerulonephritis, right? But in case of minimal change disease, the blood pressure is normal. And in all diabetic patients, the blood pressure may not be high. It may be normal as well, right? But focal segmental glomerulosclerosis, membranous glomerulonephritis, these patients may have the hypertension. So now, which of the following feature will not be there in patients with nephrotic syndrome? That is hypertension, because in minimal change disease, the blood pressure is absolutely normal. So the answer here is the hypertension, right? Next question. Thrombolytics can be given in the treatment of acute MI if the patient comes within 12 hours, 3 hours, 6 hours, 24 hours. Okay. Now, in case of acute MI, right, we have two important terminologies. One is door to needle time, right? Door to needle time is the time for thrombolysis. This is around 30 minutes. Then we have door to balloon time. Door to balloon time, it is a time for the percutaneous coronary intervention. So this is around 90 minutes. Okay. So that means the time at which the patient has entered into the hospital door, you have examined the patient, done an ECG, found it as an acute MI, counseled the patient and attendants, placed the needle and started the thrombolysis, that should be done within 30 minutes. Whereas in case of percutaneous coronary intervention, right, from the time he has entered into the hospital door and you have placed the balloon into the coronary artery and opened the coronary artery, that should be like within 90 minutes. That should be within 90 minutes. Now, the question is, like thrombolytic, what are all the various examples of thrombolytics? One is streptokinase, next is urokinase, then next is tenecteplase, then altiplase, then we have retiplase. These are all the examples of the thrombolytics. So, what is the cutoff time for thrombolysis? That is 12 hours. If the patient comes beyond 12 hours, thrombolysis should not be done. Why? Because within 12 hours, there will be like transmural infarction, death of the myocardium. So after 12 hours, even though if you open the vessel, like it will be of no use. The myocardium is like completely dead. That will not revert back. Okay. So thrombolytics can be given in the treatment of acute MI if the patient comes within 12 hours. Okay. So the answer is A. Next question. Which of the following disorder is characterized by the Hurdle cells? Now, so options are agranulomatous thyroiditis, papillary carcinoma of thyroid, thyroglossal cyst, and the Hashimoto's thyroiditis. So you take this Hurdle cells. Hurdle cells are the cells which are present in Hashimoto's thyroiditis. What is Hashimoto's thyroiditis? Hashimoto's thyroiditis, it is an autoimmune disorder which is the most common cause for the hypothyroidism, right? So it is an autoimmune disorder, right? Now, what are Hurdle cells? Let me explain. Now, into the thyroid gland, there will be lymphocytic infiltration, right? There will be lymphocytic infiltration of the gland. Now, these lymphocytes, they produce the antibodies. The antibodies, they destroy the follicular cells, right? They destroy the follicular cells, okay? But some, right? But some surviving follicular cells, right? But some surviving follicular cells, they are filled with a pink colloid. And the surviving follicular cells which are filled with pink colloid, they are called as Hurdle cells and present in case of Hashimoto's thyroiditis. Okay. So this is about the characteristic feature of the Hashimoto's where you have the presence of the Hurdle cells. Right. So these are the questions which have been asked in the Rajasthan MO exam. Right. So regarding the upcoming NEET MDS exam or INI MDS exam, if you have got any doubts, you can ask us all your doubts on DBMCI MDS group on Facebook and as well as Telegram, right? And we are there for you to help you to step up in your career. Thank you very much. See you in the upcoming sessions.